some of the patients have difficulty seeing in different situations. So hopefully this talk will be helpful and inspiring and interesting. I feel very honored to be part of this illustrious group and sharing my thoughts on this topic. I do work with a lot of the companies, including Allergan, Novartis, Aurasis, and Vicis. I think, and everyone here on the call and all the listeners, everyone knows about presbyopia. You can see I have just the start of presbyopia. I'm in my 50s, so I'm a little bit further down in the curve. But I just started wearing these glasses the last year or so, just for the smaller print. And I can actually see my computer screen without glasses, but it's just crisper. At this point, if I just put this is a +1, just give me a little extra amount of reading. And it affects people, in all different ages once you hit the presbyopic age group. We know it's age-related. It's very common. You can see it's, the world population, presbyopia is a huge amount. And it's a significant unmet need because there's lots of options. Many of them involve surgery and or contacts, and we just need some more options that can help our patients. When we think about it, this loss of range of vision can affect people differently. So we know our hyperopes, that hits them earlier. They become presbyopic and they can't read. I'm more of a mild myope, so that's why I'm in my 50s and just now starting to wear reading glasses. I also, like Dr. Keelik, perform lots of cataract surgery. And when we place monofocal lenses, they immediately become, in a sense, lose all their range of vision. They have no real options other than to wear contacts or glasses at that point. So there's really a wide number of patients that could benefit from therapies that can help with increasing their range of vision. Patients tell us every day, because again, as Dr. Keelik and I, Dr. Morokin, we know we're refractive surgeons. And so you see these patients coming in frustrated with presbyopia. It's worse when it's dark, so having bright lights help. They get headaches, eye strain, vision blur. Again, not as serious in some respects as the retina and what we're discussing today for the retina issues, but it affects our patients so commonly. It's such a widespread issue, which is why this is an important development. Let's just look at one patient. We've been doing refractive surgery for the last 20 to 25 years, and we're seeing now lots of patients that had LASIK in their 20s and 30s, and then they get into their 40s. The LASIK were great. They have great vision for distance, but now they can't read. And it's tough because they don't want to wear glasses anymore. They want to, they don't want to return to glasses, but the surgical options in these cases are very not the best. We'll talk about the options, but having a therapy that they could use, like drops for presbyopia, may be quite helpful. And that's I think a lot of patients are waiting for this technology. Here's another situation. There's a patient in their 40s that has a form of keratoconus. They have some degree of keratoconus, so they can't have LASIK, they can't have PRK. Refractive lens exchange, it's really tough to correct this. So having the ability to, one of the therapies would be to make the pupil smaller. It can really help this group of patients with keratoconus. Here's my list of surgical options. I bet I missed one or two options, but we know we have LASIK, SMILE, PRK. We have refractive lens exchange, including a pinhole IOL that's available in Europe, but not yet in the US. We have corneal inlays, which have lost their popularity. As far as the ones here, I didn't list the allogenic inlays, which I realized I should have, since Dr. Morokin and Dr. Keelik are some of the pioneers in that area. So actually, there are some other ones that aren't listed. There's some scleral inserts to make the sclera more rigid to restore some flexibility of the lens. There's using a laser to the sclera to restore flexibility of the sclera. There's reduction of pupil size, which Dr. Agerwal has developed, which is the fourth row pupiloplasty, which is almost, again, like the eye drop. It makes the pupil really small, but it's permanent. And conductive keratoplasty was available in the past, but has dropped off. So there's a long list, and then there's non-surgical options, including spectacles, contact lenses, and now these drops for presbyopia. So there's really two categories. One is to make the pupil smaller. And there's multiple companies that are competing in this area to come out with their technologies. We have Allergan, aurasis, presbyopia therapies, and Vicis. And the whole idea is that by making the pupil smaller, we get this enhanced range of vision. And you can see that in this picture that you can see up close, but also distance by making the pupil smaller. There's a second technology, which is try to make our natural crystal lens softer by breaking some of the bonds within the lens. So it's called lens softening technology, and we'll talk about that next. So the one company that I'm aware that has this technology recently sold their technology to Novartis. Basically, it's this technology where it's an eye drop that goes on the eye. It's a prodrug. It basically gets broken down into some naturally occurring substances, and that can break the disulfide bonds that can restore the lens microfluidics. Basically, the lens is softened, and now the lens can flex more. And so it's basically, as Dr. Marshall just talked to us about rejuvenating the retina, we're talking about rejuvenating the lens here. Dr. Marshall had a great, I guess, talk to prepare us for this concept with this technology, which is still a few years out, but very exciting. And then they had some data that they released that publicly, and this is showing that looking at the percent of subjects that gained vision at near, and you can see that over time as they took these drops, they had more and more patients getting some improvement in their near vision. So we're looking forward to seeing how this works long term and whether this can really make a difference for our patients. Now, the 4 drops that have been developed, or 4 companies that are developing drops for presbyopia that are making the pupils smaller. There's multiple different technologies being used. One's called acyclidine, which is a company which makes the pupil smaller with tropicamide. And the concept is that this combination makes the pupil very small, but the tropicamide helps prevent it not getting too small, and then again gives you this increased range of vision. So it's kind of a double a combination drop, but trying to just optimize the pupil size at a certain level to give this nice enhancement of our range of vision. So again, this is called PRX 100 by Liquid Vision. So we're excited to see this technology. It's in the phase 3 clinical trials, I believe, at this point. Aurasis is the second company. This is the company that's developing their product. It's a low-dose pupillary miotic that, again, trying to give this range of vision. And what they've been working on is to make sure that their patients can get this near vision, but also not lose their night vision. If you make the pupil too small, then patients really complain about driving at nighttime. And so they've been working hard to try to optimize their drop for that, get that nice range of vision, but still work at nighttime overall. So a very promising technology. Again, still in the clinical trials overall. A third company, Visus, is developing this medication that they're calling bremichael, which is a combination of brimonidine and carbachol. And basically, the 2 medications work synergistically to make the pupil smaller, but not too small. The carbachol makes works on one part, works on the sphincter contraction, and brimonidine helps prevent the iris dilator from contracting, so you get a nice pupil size. They're calling this bremichael. So again, very promising. And they do feel that there's an impact on ciliary body, so you may avoid some of the headache and brow ache and myopic shifts that may occur with some miotics. Again, still early, but exciting. And the last company that's very exciting as well, and who I think they may be the farthest along, at least in the US, for getting approval, is Allergan. They have a very exciting technology. It's a miotic, just as we run through all these companies. Again, it's a proprietary technology for the delivery device, their delivery technology. And again, making the pupil smaller to get this nice range of vision. So how this drop for presbyopia changed the life of patients. I know for me, I'm in my 50s, and for my patients in the 40s, we're excited to be able to use a nice drop that we could use that we could reduce our need for reading glasses and get to experience what it's like before we commit to surgery. There are many surgical options, but surgery has some risks. So let's see how they work. And it may direct some patients going one direction for one type of surgery versus other patients may choose a different direction depending on how the drops work for them. And some patients may just prefer using the drops if it's easy, or some may say this is good, but I'd rather just have a permanent procedure. The key is that as far as how it's making a difference for our patients with drops for presbyopia is that our patients want something that's very safe with a low rate of ocular irritation and discomfort, no long-term side effects. They want it to be reversible, which this all works, and is long-lasting in the sense that the hope is that it's going to be once a day, might be twice a day, but at least the goal is once a day for our patients. And what happens if we can deliver this? Well, as we get older and, when you start putting reading glasses on, it automatically ages you. You, by definition, are a little bit older because you need reading glasses. So it keeps us having the appearance of being youthful. We can use Botox and superficially look young, but when you wear glasses, it's a giveaway that you're not as young as others. So it helps keep us youthful. And we work with our coworkers, again, for our patients, being young is, it's desirable by many of our patients. and not appearing like that older. So not needing glasses at work could be quite helpful. So I think this is exciting technology. We're really excited for it to become available for our patients. It seems it'll be very easy to prescribe for patients. We'll get a nice sense once we have it available to how it can help our patients. And I'm very excited and happy to answer any questions. Thank you very much.
Thank you.
Thank you so much, Bill. It was really very exciting technology. Actually, we can discuss details, but I just want to ask you very general questions to make it clear. We can use these drops both eye or one eye. And second question is, all refraction, what is the indication about refraction?
Okay, so if you make the pupil, the drop is very effective on a patient, and probably by patient, and the pupil becomes too small, they'll feel they may not feel great with it. They may be able to read, but they may feel they have too much loss of their visual field. So you may only, in that patient may only use it in one eye. If you get meiosis in both eyes to a good level that works for that particular patient, they may feel comfortable using in both eyes. So it'll probably be a patient by patient customization depending on their pupil size and how the drop affects them.
Yeah, of course. Okay. What about refraction indication? Emmetropic patients, or you showed a nice keratoconus patient with astigmatism. Also, we can use keratoconus patients, and also myopic, hyperopic. How is the range?
Right. I mean, I think that's something we're going to learn. I mean, when you have a pinhole effect, you we do that all the time in our clinic. We know we can get an improved range of vision. So it'll be patient by patient and how it works for them. Obviously, if you're emmetropic, it's going to work better, but some myopes or hyperopes may do okay, and we'll have to see for each patient.
Hello?
Yeah.
Yes.
Sorry, switch on your microphone.
Hi, great talk. Given I'm a myope who's now compensating by pushing his specs down the nose, I'm very excited about your talk. But just as some general points, people who want to avoid reading glasses who are emmetropic before do it partially because of social interaction issues, and a popular notion about being attracted to somebody is having a big pupil. Has that been come up with any patients, or is that an issue? You're a refractive surgeon, you've got to deal with these things.
So that's a great one because younger patients have bigger pupils. You're absolutely right. So having a bigger pupil is a sign of youthfulness as well. So that's the first time someone's mentioned that, but I really appreciate that you're sharing that concept. Yeah, I don't have a good answer for that yet. I'm sure that will come up.
Could have cosmetic contact lenses with a big pupil on top of your myosed eye. How about that? I'm happy to go into business with you on that one.
I like that.
Well, guys,
I think the corollary of that that Adnan has just brought up is in London, if you get stopped by the police with small pupils, there may be quite significant consequences.
Anyway, this is a problem mainly for people with blue eyes in whom you can actually see the people. In people with very deep brown eyes, I have trouble seeing their pupils. They'll love this drug.
Are you a presbyopia?
Yes, I am.
So in our field in refractive surgery, more than 50% patients visiting us to remove glasses, reading glasses. And they are always dreaming one laser and everything finished. They will see distance, they will see near, both at the same time. This is really big trouble for us. I refuse so many patients because of limitation of lasers or premium intraocular lens. I think this drop is very useful for future, because if people is emmetropic, we cannot recommend surgery very comfortable. If we correct near, always distance region sometimes affected. So multifocal lenses, especially, we cannot perform, and we want to remove glasses. Maybe as you are a refractive surgeon, your patients are very, I believe this drop, if it would be in the market, I would use this, not every day, sometimes even I can use myself, sometimes special days if I want to see clearly. This is really amazing technology. I am excited about that.
Bill, there's a question from the participants. How long do drops last? So are you putting in a drop and it lasts for a week, or do you have to drop every 2 hours, or what's the?
So my understanding is that most of the drops are working anywhere from 6 hours to 12 hours, depending on, well, and of course it's going to depend if they're blue-eyed, brown-eyed, and the effects, and what the optimal size is. But my understanding is that for some patients it's going to be once a day. Other people, it might be twice a day. But I don't think it'll be more than twice a day.
And what is your experience in terms of patients, let's say, compliance in using the drops? So I can see in a study environment where they take the drops for a defined period of time, that's fine. But if you think about, this should be an alternative lasting 5-10 years. Any experience of how the patient compliance in using the drops is?
Right. I mean, I think the compliance will be similar to remembering to bring your glasses. You either bring your glasses or you can't read. You either put the drops in or you have to get glasses to read. I mean, otherwise, it depends on their life, what they're doing that day, right? So if someone's just going to be outside running and they're or they're going hiking, maybe they don't feel like they need to put the drop in that day. So on what the patients are doing. But a great question. I don't know the answer.
I was fascinated by the drug that is, making the lens soft and young again.
Yes.
So I didn't really understand, to be honest, the mechanism, but is there any concern that will affect long-term other parts of the eye, like the retina? Are we creating more drusen?
Yes. Oh my gosh. I think that's a great question. EVO6 was developed by a small company and they sold it to Novartis, who is working on right now on getting it through the FDA approval process here in the United States. I did reach out to them to find out they're still under development, so I don't have a lot of details. And I don't know the full safety profile yet. So it's promising, but obviously with everything, there are pluses and minuses to everything. So we have to make sure that it doesn't cause a problem.
At least it would reduce the retinal irradiance, Michael.
Okay.
Yes. also will protect retina from UV light with meiosis. This is also wonderful. Also may prevent from cataract.
It may make it difficult to laser through, John.
It's going in the infrared.
But you wanted to treat at 40 anyway, John. So we first treat with your laser and then we use the drops.
Wonderful.